Hi, and welcome to this edition of Healthcare Leaders in Simsbury. I'm your host, Kurt Palmer. In our previous program, I mentioned to you that for a small town, Simsbury has a tremendous amount of assets, whether it's our beautiful neighborhoods, great recreational and entertainment facilities, places to dine and shop, or our top-notch schools. We really have a lot to be grateful for and the tremendous assets we have here in town. This program really features the people assets, folks that have lived or work in Simsbury that have made a contribution, particularly in the area of healthcare, insurance, and employee benefits. And I'm very pleased to have as a special guest here on the program, Griebel, who since 2001 has been the president and CEO of the MetroHartford Alliance. The MetroHartford Alliance's mission is to ensure that Greater Hartford competes aggressively for capital, jobs, and talent. And a part of the MetroHartford Alliance is the Connecticut Health Council. The Connecticut Health Council's mission is to really promote Connecticut as a center of healthcare excellence. So, thank you so much for being here. I really appreciate you spending time with us.
Pleasure to be here, Kurt.
So the first question I like to ask my guests, because the focus is Simsbury, is how did you come to be in Simsbury, and maybe you can share a little of your experience in town.
Sure. In 1993, I was with what was then Bank of Boston, and was transferred down here. We had acquired Society for Savings, so I had the opportunity to come down and work with a group of people who were leading the bank down here. We had young children at the time. Our oldest was in third grade, so we were looking at the right area. Both easy commute, but more importantly, having a good school system. So that's how we got here, and lived here in town for 20 years. Was heavily involved with St. Mary's Parish and with Little League and other youth leagues here. So it was we had wonderful friends here in the community, many of whom I stay in touch with. So it was a great 20 years.
Yep. Well, you've had an opportunity, having been in the community for a while, and been active on civic and business boards, and so you've had a chance to interact with a lot of people that are in the healthcare and insurance business.
Right.
And I want to get to the Connecticut Health Council specifically,
right.
But I'm interested in your perspective on the healthcare industry overall. I mean, there's plenty of questions and debate about cost and complexity, the Affordable Care Act, and so forth.
Right.
So maybe you can share a little of your perspective on healthcare in the state or generally?
Well, I think the most important thing I could say in this conversation, Kurt, is how important the health sector, and I'd even slightly more broadly defined than health care, how important this sector is to the state today in terms of the number of people who are employed, the total wage and compensation packages that they earn, therefore the taxes that they pay, the amount of capital investment that has gone on. So if you take anything from the medical schools, relatively new one at Quinnipiac that complements the UConn Medical School and Yale's, the School of Dentistry at UConn, all that in what I'll call the higher ed area, complement that with the research that goes on in the engineering departments, R&D in those areas that complement things in the biomedical device areas, the pharmaceutical industry that's here. It's a critically important component. We always look at the three major drivers of employment and capital investment in this state as being precision manufacturing, which remains a robust and very important part of the economy, the insurance industry broadly defined, including health insurance sector, and then the health sector broadly, as I said a minute ago, broadly defined. In fact, in the health sector, you could also put in the higher education world. Those are really important to a state that's always going to be at the higher end of cost. And is going to drive its economy through its intellectual capital. So those three areas are one there, and therefore I think we'll get to the Health Council in a minute, but promoting the health sector is very important. Advocating directly or indirectly at the Capitol to ensure that the environment remains conducive, hospitable, encouraging to entities that are in this sector to grow here, to relocate here, to start here is an important area. At the same time, we recognize that there is so much, one could even use the word turmoil, in the sector with many of the larger, whether it's the health insurance companies, the Cigna and Anthem transaction, and Aetna and Humana transaction. They're working its way through the regulatory processes here. Whether it's the hospitals, going from what we had 33 independent hospitals as little as a decade ago to now, depending on how you want to count them, really 3 major systems in the state with other ancillary systems forming. It's a tremendous amount of change, and I think what's important about our role and really the political leadership's role is to make sure that as these changes occur, that Connecticut remains a focal point, remains a center of headquarters, remains a center for research, and retains its competitive edge, which we think it has as we go forward.
Well, there's no doubt that there is turmoil in the industry, and I think the idea that there are so many new technologies coming
no
into
question
play,
about it. Absolutely.
Startups, early stage companies that are doing very disruptive things to the way that healthcare has both been insured and delivered. So hopefully the work that you're doing will continue to attract those kinds of companies and advance their causes as you go. So about the Connecticut Health Council, I actually have been involved in that, and so I have some familiarity with it, but I think it would be helpful for our audience to understand how it came into being, what its main mission is, maybe some of the activities that you've undertaken to date, and then some things that you have going on in the days ahead.
Well, brief context, the organization's 15 years old, and about 2003, our second or third year in, we started something called the Connecticut Insurance and Financial Services Cluster to focus on that sector that I mentioned a minute ago, be an advocate for it at the Capitol, promote the brand of Connecticut as the insurance capital, and we did that's had a very good run of success. Susan Winkler is the executive director of that and has done a great job and been supported by the insurance sector broadly. We every 4 years go through an evaluation with our investors, and in 2011 when we did that, Bob Petroselli who is on our board and a Simsbury resident, highly successful entrepreneur, as now his current endeavor has been Women's Health USA. Came to us with an idea to a large group of our investors to say, gee, I've come across Nashville's site and the Nashville Healthcare Council, and they declare themselves the Silicon Valley of healthcare. Why can't we here in Connecticut do the same thing? So in 2012, we formed the Connecticut Health Council. People like Marty Gavin, who was then at Children's Hospital, Elliot Joseph at Hartford Healthcare, Bob himself, helped us, Mickey Herbert, who was then working in a consulting capacity, former CEO of Connecticut, helped put this together. And the concept, similar to the IFS cluster, was to promote this, but really much like what Nashville does is to build a big tent. So unlike what we do with a cluster, we don't necessarily go up and advocate specifically at the Capitol for any one of these sectors. Because as I said earlier, this sector is very broad. It's hospitals, it's insurance companies, it's the medical practices, it's the medical schools. It's a very diverse group, all of which are critical to ensuring that Connecticut is this center of health excellence. So as you said a minute ago, the mission we formed was we formed the Health Council, and the word Connecticut is in it. It's not the Hartford Health Council, is to promote the state as a center of health excellence and as a driver of employment growth and increased capital investment. So the way we've gone about it, and you've been good enough to attend a number of them, we've built the big tent primarily through programs, and we put programs on for not just the entities, what we call our founding partners of the council, but for the general public, to showcase specific things that are in here in the state that we believe help elevate this reputation of being a center of health excellence. And those programs have been on everything from mental health to the SIM initiative that was launched by the state several years ago. We've had discussions about diabetes and had folks from the Joslin Clinic down to talk about what we have here. Last year, when we went through after our fourth year, one of these 4-year cycles, a number of the folks in the Health Council was challenging us to say, well, that's been okay, but what's that really doing to elevate the stature? I think the point we've landed on, Kurt, and I think it's, is we look at the challenges that the state has fiscally at the state level and then at a number of our municipal levels. it's pretty clear that greater collaboration is the way we have to go. And as we're seeing this, as we talked a minute ago, you're seeing consolidation in the hospitals. You're seeing consolidation in the hospital in the health insurance sector. You're seeing consolidation in the medical practices themselves. That's going to put certain pressures on each of those silos. And our concern, and what we believe is the glass half full approach, is by these sectors talking more to one another, seeing where where one sector can benefit another, as opposed to being solely in the competitive you win, I lose concept, is where we're trying to go. So, and we can go into as much detail on this as you want now or later in the conversation. We're trying to elevate this through a forum we're going to hold in D.C. In September, where part of the goal is to get some leaders from the health sector out of town, out of Dodge for 24 to 36 hours. Have that kind of networking opportunity, be informed by policy leaders in D.C., but also showcase what Connecticut is doing to those policy leaders, people from NIH, people from our own Connecticut federal delegation, to other leaders who sit on committees of cognizance, that when you're looking at where you might want to experiment with federal dollars or NIH dollars, look at Connecticut. Look first of all, our size, which in this context is really a benefit. We're not spread across. You can deal with the entire state, as we know, subject to traffic on I-95. You can get through the state in about 2.5 hours. There's tremendous, as I said earlier, tremendous intellectual capital in these sectors. So this notion of, again, making sure that we keep our eye and do everything we can to support this very important sector is what the council really is all about.
So the event in D.C., I think it's in September, you
Correct.
mentioned.
Yep.
This is independent of any kind of public sector involvement or Connecticut state government. This
Correct.
is really just the Connecticut Health Council organizing and coordinating this.
Yeah, and we hope, having said that, Kurt, we're hopeful that the governor or Catherine Smith from DECD or the lieutenant governor who's been heavily involved with Access Health, that they'd be part of this discussion, not to be the primary areas of focus, but to listen the way we're asking all the attendees to listen to what other people are doing in the sector. And it's not that the conversations aren't going on in some way, but they tend to go on in the context. Let's say the health insurers having their negotiations with the hospitals. They're talking, but they're talking about specific contractual relationships. Right. Insurers want to make sure that they're getting paid an adequate rate. Hospitals wanting to make sure that they're getting full coverage, not paying more than they want to pay. That whole debate that goes on. And those are going to continue to go on. What we want to do is see if we can find a way, and I don't know whether elevate's the right verb, but to have a discrete conversation about how we can play together and make Connecticut and make our health sector important. The one important thing that's emerging here, I think, Kurt, that we're hopeful we're going to get some, for example, on the hospital side, that we'll get some board members to attend. Many of the board members, chairs and whatnot, as you know, are leaders within private sector entities, non-hospitals, non-health sector areas. But we know that if we can get our arms around the quality and cost component for employers, this can be a competitive advantage for Connecticut. So that when an employer is looking, whether it's a GE looking to move to Boston, whether it's a UTC looking to see where their next capital dollar is going to go, whether it's one of our insurance companies, whether it's one of these startups that we referenced earlier, you're going to look at Connecticut to say, not only do we have great schools and we have talent coming out, and not only do we have access to great recreational facilities, but we are making significant progress in the quality and cost of the health care you can provide your employees. We think that's something we've got to look at, not for the benefit, just for the benefit of the health sector entities, but how we can make that work for all employers, and for that matter, all residents, obviously.
Given the fact that benefits and particularly healthcare represent 30 to 40% of their operating budgets. Right. If you can do anything to reduce that, then that's going to be an attractive way to keep them in the state or attract them to locate in the state in the first place. Which brings up another interesting point, and I know MetroHartford Alliance, through its own separate programs, is really working to generate interest and enthusiasm among young people, particularly folks coming out of college.
Right.
And I think there seems to be good coordination. I'm sure there's more to be done relative to recent graduates finding a role, finding a job, finding a career in the healthcare sector, in the insurance sector. And so maybe you can speak to how that taking place between both the Connecticut Health Council maybe and the Hartford Young Professionals Group, HYPE,
Right.
and then the MetroHartford Alliance itself.
Well, just to stay on hype for a second, it's 10 years old. In fact, it's a major celebration on June 8th downtown at Infinity Hall. Any of the folks here in Simsbury want to join that? It's been one of the great initiatives of the Alliance. A woman by the name of Julie Daly-Meehan has led that from its inception. And so there's a great celebration of that. It tends to focus a little differently than to your question on individuals who are already in the workplace, making sure that young professionals in this region know that there are other young professionals, that there are opportunities for them to contribute in civic life as well as on their professional life. That's been an important component of it. We do a lot with an organization called the Hartford Consortium for Higher Education that both looks at helping to prepare K through 12, or particularly 9 through 12 graduates to be ready in the city mostly, and making sure that that future part of our future workforce is getting an appropriate education and being moved on to post-secondary education. A lot of work with those higher eds, UConn, UHart, and the like. The one thing that I will say on this tad of sort of the glass half empty concept is that for a young person to want to stay here, there have to be the jobs. And so to go back without repeating what I said earlier about how important the health sector is, we've got some interesting dynamics going on up at the Capitol right now and have for the last year. The issues of everything from positions taken by the legislature that have not allowed for acquisitions by some hospitals. And you can debate whether that's good or bad, but understand that this is happening. Mm-hmm. And if we're viewed as a state where we don't want for-profit entities to even be considered, that may be in someone's mind the right policy decision, but understand that it takes away capital opportunities, takes away job opportunities. Some of the issues we've got going on at the state right now in terms of the budget we're wrestling with at the moment, some of the things that are being cut there, some of the taxes being placed on the hospitals, those are of great concern to all of us, because we need an environment where all entities see this as a place where they not only want to keep the job that they have here, but they want the next job that the next person they hire to be here in Connecticut. The next R&D dollar that they spend is going to be spent here in Connecticut. And there's no question we're fighting an uphill battle, and have for the last 7 or 8 years after the 2008 horrific recession hit, and the impact that it's had on the kinds of jobs that have replaced. Yes, we've replaced most of the 120,000 jobs, but not necessarily at the same compensation levels. Mm-hmm. We're definitely facing a significant reduction in tax revenues, in large part attributed to that. So we always are looking at the glass half full about all the great things that Connecticut has, but also being politically realistic about things that have to change if the private sector is going to look at Connecticut as a place when they want to do business. I don't want to make a bigger deal out of the GE move than it should. It's in the sense that it's 250 jobs or whatever it is. They just made an announcement the other day that 500 or 600 jobs that are going from the Fairfield campus over to Norwalk, so they're staying in Connecticut. But you can't take your eye off of the for the lack of a better word, the public relations impact that
right.
The move of a brand like GE is to Boston for the reasons they did, greater access to schools, transportation, and the like. So there are issues that we're looking at along with a number of other organizations, other chambers here in the state that are important, that we really keep a focus on a public policy arena or set of public policies that create and sustain a constructive environment for private sector investment and private sector employment.
You know, on the positive side of the ledger, relative to what's going on with folks, maybe leaving or staying, there's also the creation of new healthcare related entities.
Correct.
So
No question.
You've got the Jackson Labs as a perfect
It's a great
example.
example. No
Science
question.
and technology
Right.
taking a major role
Right.
in the state right here. A leader in its field,
Yep.
and so that most likely is going to attract some very good talent, some
Right.
high intellectual capabilities there. So that would be one example. But I'm interested in also your perspective on any kind of organizations or structure for innovation, incubation, that sort of thing, because there are so many companies that are looking to get a foothold in this business. what's going on either locally in the Hartford area or more broadly in the state?
Well, there are a number of things. Tonight, for example, we're hosting an event for 3 Israeli companies, 2 of which are in the health sector. So a lot of foreign direct investment. There are a number, what I just went through on the domestic side, how we compare favorably or not with other states. There are many foreign companies that we're trying to attract. We've had a history of 40 years of German companies, precision manufacturing companies being here in the state. We've made inroads with under the Malloy administration with Catherine Smith with Israel. So the idea of promoting Connecticut as a jumping off place if you're trying to move into the U.S. market as a place where you want to go is an important element. Connecticut Innovations has a $1 million competition that they launched last month on the fintech and health tech areas to attract companies. I think there'll be 5 winners. Actually, it's a $5 million commitment. I think the winner gets $1 million, and then there are prizes down below, so long as the company is either located in Connecticut or relocates to Connecticut. We have a very strong relationship with an entity called Reset, which is Kate Emery started as a social enterprise organization. They open offices over in Park Street to have with accelerator programs. There are a number of things going up at UConn, NERAC up near the Mansfield campus. There are a number of entities that are around. You've got I'm not as familiar with it, but I know that there's a relatively robust angel a set of angel investors that are looking to that. So the beauty of Connecticut has always been its intellectual capital, the ability to reinvent itself or to find the next new invention, whether you go back as far as the bicycle or Sikorsky and the helicopter or the United Aircraft before it was UTC. I mean, there are a series of things that have gone on in this state. And clearly in the medical side, and this is where anesthesia was invented or discovered back in the late 19th century. So I think what we're trying to be sure that we do in the state, working with Governor Malloy, working with the legislature, working with other political leaders, and working with leaders in the sector, as I said a minute ago, is to have that environment where Jackson Labs, to your point. Jackson Labs came down because the state made a very aggressive move. Governor Malloy when they were looking to take their genomic research and go to Florida, and Florida decided not to fund them. We're fortunate that they chose to come here. The goal, though, Kurt, is to try to do as much as we can where a private sector entity will come in on its own nickel, or the bulk of the investment its own nickel. And there's always going to be a role for government. It's important that government not only provide the basic services in terms of roadways and the like, but also that we know that our educational systems are providing the kind of talent that people want, that we're brokering relationships with either other entities in the state or elsewhere so that a company like Jackson Labs, an entity like Jackson Labs will be successful, but ideally not necessarily with the state support that's needed.
Right.
And that's where I think we need to go, and where a number of folks are trying to drive the state.
We got just a few minutes left,
Sure.
and I wanted to ask you a question, which is probably subjective in nature, but we've always thought of ourselves and maybe been known in the industry as the insurance capital of the world.
Right.
I guess the question is, are we still that? And if so, why? And if not, why not?
Well, the simple answer to the question is, if you don't declare yourself the insurance capital, nobody else is. And there are plenty of other areas around the state, the country, who will say that they are. We believe that is still, and use it, that we are the insurance capital. As I mentioned her name earlier, Susan Winkler, the last several years we've done an insurance market summit. That'll be held this year on November 10th. We have 3 CEOs from MassMutual, Voya, and from the Hartford, Chris Swift from the Hartford, to ideally attract people from around the country to showcase what is going on here in the state of Connecticut, the kinds of intellectual capital we have in these areas, some of the innovative things that are going on in the sector. Part of having spent most of my adult life in New England, New England is always reserved. I think our puritanical roots still permeate all of our DNA. But one of the things about Connecticut that I will say in the 20 plus years I've been here versus Boston, there is much more of a willingness or inclination to beat our breasts about how bad things are and not see the glass appropriately half full. We have issues. Every state in the country has issues. This country has issues. The asset base that we have here, particularly the people, are our strongest ones. And so if we don't say we're the insurance capital, I say it the other way around. For a while, people were saying we're not the insurance capital anymore. When Governor Malloy was running in 2010, I heard him say it twice, and I went up to one of the folks where, please tell him to stop saying it. If he's going to say anything about the insurance capital, say we're the insurance capital. Prove it otherwise,
right.
Because if you don't talk about the asset base we have here, and there is still a very, notwithstanding the turmoil we mentioned earlier, not only in the health insurance area, but it's in P&C and life and everything else, every other sector of the business. But we have headquartered companies here. We have tremendous intellectual capital. We have more actuaries per capita than anywhere in the country. There is an asset base here that allows us to say we are the insurance capital, and I hope some folks will come to this summit on November 10th at the Convention Center.
Well, that sounds great. And I know from personal experience, having attended Connecticut Health Council events, you're attracting some very influential people, leaders in the field of healthcare and insurance, who do nothing but elevate, as you've been saying, the whole point of view of not only this community, but people from other parts of the country who now look at Connecticut and see all the assets that Connecticut has in this industry. So
Right.
I know you've been working hard for the betterment of this area through the MetroHartford Alliance and certainly the work that's being done at the Connecticut Health Council, and I certainly wish you all the best, continued good luck and success. And I, again, want to thank you very, very much for being a guest here today. Your comments are really interesting to listen to and informative for our audience, so I appreciate it.
Well, I appreciate being here. As I said, I had great 20 plus years here in Simsbury, and I've remained a lot of friends, and this is part of the same region. That's the one thing I want to make sure we all remember.
Very much.
We're all in this together, all 1,000,002 of us.
Very much. Well, thank you to our audience as well. We appreciate you tuning in and hope this program was informative for you as it has been for me, and we'll look forward to talking with you again next time.
Since 1984, SCTV has been the place to turn in Simsbury to watch local government in action. But we're more than local government and school meetings. SCTV is the only place where you can check out all the candidates in local elections. We have high school sports and exercise classes. Other shows keep you up on health, finance, poetry, music, and Simsbury hot topics. Now we need your help. Simsbury Community TV is embarking on a major capital fundraising campaign to bring SCTV into the 21st century. We've received a generous grant from the Hartford Foundation for Public Giving, but now we must match it. We want everyone to watch us on TV or on our website, but even if you never do, please help so that we can continue to keep your government open and you informed. Someday, when there's a crisis, you will want SCTV to be there.
Hi, my name is Lydia Tadone, a member of the Simsbury Board of Education. I hope you'll join me in supporting SCTV. Since 1984, your connection to your town, your schools, and your government.